wide open, an activity that we started seeing from the 4th of January 2021. Some of them have gone to study under the trees, literally just as directed by the education CS Professor Mogoha. You know, of course, I don't know, I think it was figuratively, but I mean, people have taken it literally. And we have seen a number of schools across the country, people studying under the trees. Some students, social distancing within the schools has been a great challenge, to mention but a few. The whole country has been having discussion around schools and schools reopening, school fees, status of school, the readiness of schools for as far as studies amidst the pandemic is concerned. But as Muslims, we are obligated to teach our children not only the education that will save them and help them in their dunya, but of course in their deen as well. And that's why tonight we'll be touching, of course, on the madrasa, something that if we don't talk about, then who will? Welcome, and joining me this evening in the studio to talk about this topic, a face that you saw last week and the other week, and you've seen it again and again and again, and we'll keep on inviting him because a lot of wisdom coming from him. So we'll keep on inviting him until we benefit as much as we can from that wisdom. Professor Muhammad Karama, who is the chairperson of the National Muslim Response Committee on COVID. Assalamu alaikum, Sheikh.
Wa alaikum salam wa rahmatullahi wa barakatuh.
Thank you so much for making time for us once again this evening. And of course, with him, we have my namesake, of course, who is also a member in the, or rather a technical member, an advisor to the National Muslim Response Committee on COVID. That is my namesake, Mr. Faisal. Assalamu alaikum.
Wa alaikum salam wa rahmatullahi wa barakatuh.
Thank you so much, Mr. Faisal. Our pleasure to host you for the first time on Horizon TV.
Thank you.
Karibu Salam. And of course, last but not least, we have Sheikh Abdul Latif Abdul Karim, who's also joining us, of course, to talk on matters, especially the madrasa aspect. Assalamu alaikum wa rahmatullahi wa barakatuh, Sheikh Abdul Latif.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
Thank you so much for making time for us this evening, Sheikh Abdul Latif.
Barakallahu feek.
Barakallahu fikum. Now, Ikhwa, before we move further, let's talk about schools reopening. It is 1 week down the line. Schools have reopened. People are in the classes already. I'm going to start with you, Professor Karama, sorry. How is it? What do you think? What's your take on the current status of schools, even as students have resumed classes already?
Bismillah ar-Rahman ar-Rahim. We have visited a few schools, especially in the urban areas, and we have noted many challenges. One is that the social distance and the physical distance is a big challenge. They cannot attain that because the numbers of students and the infrastructure available are very limited. We have also seen that the learning under trees, however, with the extreme temperatures, sometimes too hot or too cold or very windy, is also a challenge. We have seen challenges with schools that are boarding, where students stay. There's quite a bit of challenge in terms of overcrowding of the facilities. We have seen the anxiety in students. We have seen the anxiety in teachers. They are worried. We have seen parents visiting schools to try and understand what is going on. It's quite a challenge. And I believe this is part and parcel of the reopening processes. So we would really urge that people try to understand these systems clearly so that they can know what to improve and what to do in order to ensure the safety of the students.
Thank you. Mr. Faisal Barak, being a public health specialist, of course, picking up from where Professor Muhammad Karama touched on about social distancing, about hand washing points being very minimal, about standing, studying rather under the trees. Sometimes it's windy, sometimes, and of course we are in a summer period in this country today. Few questions. One, what are some of the risk factors that are likely to be experienced, for as far as studies under these conditions are concerned? Two, children being at this stage. We have seen some footages. Some people, of course, we cannot show them here because as media practitioners, we have been banned from covering some of these events in schools, of course, we get the clearance. And of course, I, having not searched for clearance and getting a clearance, then of course I cannot show some of the videos. But there are some videos of children overcrowding in class. There is no social distance at all, and Professor just confirmed that. Hand washing points, very minimal, and these are some of the basic requirements that are needed for as far as addressing this pandemic is concerned in schools. So what are the risk factors involved in this?
The risk factors, thank you very much for that question. The risk factors that are involved are quite a number. But the kind of approach that we have taken when visiting these schools and madrasas is first and foremost to identify those risks together with the teachers, that is the ustad, and also to make them understand or have the little knowledge on how this disease is transmitted from one person to the other. So because these risk factors are not generally same in all the schools, we give them this knowledge so that they are able to identify which areas they should actually intervene in order to prevent the disease transmission. So basically, as you had mentioned, overcrowding is one of them. Also, you find that studying under a tree sometimes also has its own challenges in terms of there is too much sunlight, sometimes there is too much wind, and things like that. So basically, as we say, different strokes for different folks, in that we give advice to different schools depending on the situations that we see after the inspection that we carry out.
Well, thanks so much. So basically, if you can just recount, you say these children are carriers, or they can be super spreaders of this coronavirus?
Yes, such a scenario can occur. But the most important thing is to understand how the disease moves from one person to the other, so that we are able to put interventions, and also the teachers are able to put interventions. For example, the physical distancing, for example, the wearing of masks, example, the frequent hand washing, and also the change of teaching. You know, the teachers have to be a little bit innovative and use different methods. This one is known as pedagogy in terms of education. So really they have to come up with very innovative ways of carrying out a class, perhaps separating the students into smaller groups and then going around teaching them. And also issues like having them they make them more student-centered. The kind of class is more student-centered than the teacher-centered. So the teachers have to be more innovative in terms of teaching, especially if the class is crowded. They can divide the class into maybe 4 or 5 groups and place them in different areas.
I'm going to come back to that, of course, and there's another question. But again, I just want to bring in Sheikh Abdul Latif Abdul Karim, who I'd really love him to touch on us on as far as madrasa is concerned. Sheikh Abdul Latif, we have seen at least over 300 private schools closed. At least over 10,000 students have transferred from private schools to public schools. All these are just communicating one thing, that a number of people are not capacitated. People and schools alike, they're not capacitated to run some of these institutions. Hence, you're seeing the teething problems even in some of these private schools. Sheikh, we've seen the traditional problem that has been ongoing in duqsis and madaris. Now, do you think it is wise to have a discussion of opening madaris at this point, or they should just continue with online for those who are doing online?
Bismillah, alhamdulillah, salatu wassalamu rasulullah. First, I'd like to appreciate Kenya Institute of Curriculum Development for passing the madrasa, the unified madrasa curriculum, it's historic in Kenya. It just happened last month, alhamdulillah. That means a lot for us as Muslims in Kenya in terms of the madrasa system. It means that we are going to have one syllabus or one curriculum. It means we'll have one examination. It means we'll have a certificate which is recognized not only in Kenya but worldwide, and so on and so forth. So that's a great stride on the right direction, alhamdulillah. The other issue is, are we ready to open our madrasa? This is it's a case-by-case scenario, depending on where you are, and so on and so forth. Alhamdulillah, the National Muslim COVID-19 Response Committee has been having a number of trainings, both in Mombasa and in Nairobi. And we are praying and hoping that inshallah will roll out to other parts of the country, even by the use of technology online. We've been having trainings, alhamdulillah, from the third week of December all through. For example, in Nairobi, different areas of Nairobi. We've been having trainings for the madrasa teachers, the administration in terms of the principal or headmasters, and some of the committee members. And then these issues, as my brother Faisal has talked about, it's case by case. There are madrasas which have been streamlined. They have systems in place, infrastructure, one teacher in charge of manageable number of students, the right infrastructure in terms of classroom setup, windows, ventilation, light, number of toilets per student, and all that. And we have madrasas which are they've not put these things in to just to be fair, that they've not put these issues into place. So challenges are there. Wallahu alam. Shukran.
Jazakallah khair. Sheikh Abdul Latif Abdul Karam, just to reiterate on that point, you've seen Rwanda, a country like Rwanda, Paul Kagame built 22 to 27,000 new facilities, boarding facilities, classes across the country to try and manage learning in this COVID era. We've seen some government officials, some member of parliaments, like the Kibra member of parliament, Honorable Imran Okoth, planning to hand over the Upper Hill Extension Secondary School, new extended facility to cater for more students, or for the students that were there in this COVID era. They knew the schools were going to be reopened, so he started from last year, together with other government officials, of course, and their different capacities, to increase the capacity of some of these schools to handle COVID or education in the times of COVID. So people were prepared. Do we have madaris that have taken such steps? Painting, rather putting on stickers, social distancing, hand washing points, thermogans, and so on and so forth. Do we have such institutions that have put such measures?
Yeah, we have, and mashallah. And they are quite impressive, by the way. There are madrasas who have desks in place, curriculum, washing facilities, toilets, and so on and so forth. But you see, this kind of madrasas, without mentioning the names, but unfortunately, we can just count them with our fingers. But the majority, there are quite a number of issues.
Maybe you could mention, if it's okay, so that those madaris that are outside there, they could go and benchmark and see the preparations that have been put in place, maybe.
For example, a good example is Madrasatul Munawwar in Mombasa. Of course, these madrasas, some of these madrasas have been there for years. So with time, they've been able to evolve. They've been able to hire graduate teachers. They've been able to streamline their administration and so on and so forth. So these are not new madrasas which just came the other day. But of course, with experience of so many years over the times, they've really streamlined. In fact, they came to and asked for guidance and so on and so forth. So there are quite a few madrasas which have structures and infrastructure in place.
Okay. Thanks so much, Sheikh Abdul Karim, and my panelists in general. We are going on a very short break, but again, when we get back, we have the risk, just as confirmed by the public health specialist, that is Faisal Mbarak, that we have the risk, this is a situation that can happen. So I'd love to know, and I'm sure you would love to know as well, as a country, do we have the capacity to handle in case there's going to be a surge in numbers? You know, do we have the capacity? And in case such happens, then what's going to happen? Right now, the country, our leaders are more focused on the BBI, Building Bridges Initiative, and other political activities, the by-election in Nairobi, and 6 other places across the country. But this and much more after the break.
Horizon TV, the beacon for the nation. Pearls of Wisdom.
Abu Sa'id al-Khudri, may Allah be pleased with him, narrated that the Prophet sallallahu alaihi wasallam said, O Allah, I take refuge in you from anxiety and sorrow, weakness and laziness, miserliness and cowardice, the burden of debts, and from being overpowered by men.
On the next episode,
we as Muslims believe he never died on the cross. Do you believe Jesus died on the cross, and why?
Jesus actually, viewers, died on the cross. And there are many reasons that illustrate that.
Why would Jesus die?
Jesus had to die because God, being God of justice, hated sin. And since man had been separated from God, Jesus' death on the cross was for intermediary purposes.
What happens, or where does this leave the previous people who came before Jesus? Are they all going to hell, or what is happening?
People knew there was God, even those who never had a book. Before the missionaries came to Africa, before Islam came to Africa, before Christianity came to Africa, Africans knew there was God.
Are you too confirming to me that Jesus was this kind of a criminal for him to go through this painful, derogatory exercise on the cross?
Horizon TV, the beacon for the nation.
Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back, and thank you so much for keeping it live, Real Talk, right here on Horizon TV. My name is Faisal, Kassim, and thank you so much, my captain, Nahoda Munye, Muhammad Samubura, behind my camera, trying to do his things right there and fixing my sound. Thank you so much, brother. Sheikh, before you went on a break, Mr. Faisal Mbarak, we were talking about, I asked, at this time when the government is focusing so much on other agenda, you know, apart from the health and the COVID aspect, do we have the capacity as a people, as a country, as a nation to handle in case, وَلِيَعُذُ بِاللَّهِ, may God forbid by all means, but do we have the capacity to handle a surge in numbers or an increase in numbers once again if it happens?
Well, fortunately, as what even the professor alluded to last week, is that the children are not affected so much. The infection rates are only about 8.3% of the ones who are infected. So the children, even if they're infected, the severity of the disease is not very, very severe. So that is one advantage. Second advantage is that there are those measures that have been put in place by the government and by the protocols that have been put in place by Ministry of Education and Ministry of Health, is to have the children catered for by the nearest hospital of which this school is collaborating with. Thirdly is that there are also cases whereby home-based care is really working. This is something that has been really emphasized by the government. And fourthly is that each county is supposed to take care of their own disease that has afflicted them. So basically, I think in terms of preparation, in case there is a surge of the infection, has been well planned, and the thing is just to wait and see whether this problem is going to surge or not.
Thank you. Professor Muhammad Karama, you sit on a seat where you can advise the president. The president's action is based on some of your advices. You, as the chairperson of the National Muslim Response Committee on COVID, of course, together or under the banner of the National Response Committee on COVID-19, under that banner and other stakeholders in addressing this pandemic, you are sitting in a space where you can advise the president. You have the president's ear. Last year, we saw a number of countries that took the direction of opening the school, but it did not take long, but they had to close it down. South Africa, France, Japan, and the list goes on and on and on. So they took the initiative of opening the schools, and once the numbers started going back up, they closed down the school once again as a containment measure to contain the spread of COVID-19. In this regard, do you think, after you visiting the number of schools this week, do you think we might get to a position where we might have to close down the schools once again to contain the COVID-19 virus spread? Or it's just what I had been called herd immunity, just move and tawakkal?
Thank you very much for that question. I think the situation that we are in this country is that we are not able to provide the basic minimum preventive measures that are required as far as schools and reopening of schools are concerned. But we have the possibility that there is less transmission in the children, and therefore we hope that there will be not an upsurge of infection, because the infection will depend on the infectivity in the school children, and therefore it is very important that we ensure as much as possible that we overcome slowly some of the challenges that exist. For example, the distances, we need to do our best to make sure even within the limited space we observe that distance. We emphasize the use of masks throughout. Where children eat at school, we stagger the groups, what Faisal has said. in the dining halls, in the arrival time, so that we separate the students. And we also need to look at the curriculum and be able to reduce, not to have very high expectation. And since we are also talking about our madrasas, our main interest as a Muslim Response Committee, while we are looking at the national situation, we are in particular interested in the Muslim education system. And we are aware that many of our madrasas, we have the integrated school. This can be categorized as schools also, and the basic minimum requirements should be attained. Where we have our madrasas at the lower level, the duxis and wherever, these need to be improved. This must be improved if we are going to prevent this. The madrasas where we have one teacher moving from one class to the other and so on, this may be, we could try to observe the distance, the social distance, and we need to change also the parents' attitude towards madrasa. We have to contribute towards the improvement of these madrasas for them to be viable as preventive institutions where we are not going to risk the lives and health of the students by having to go to the madrasas. So our madrasas are a big challenge. We are aware that many parents do not pay so much attention to Islamic education. We must change that attitude. We must contribute towards improvement of our madrasas. We must pay our teachers well so that they can also feel the responsibility and be able to improve the welfare of the students. I think this is important.
So do you think we might get to a position or a situation where we might be forced to close down the schools again? Do you think that's a possibility, or is it something that's thrown out of the window totally?
Yes, currently I think that situation may not arise. Looking at the figures that we have, we're almost hitting the 100,000 mark, the infection rate. I mean the numbers of people infected, the total number. It's about at 97 or something by yesterday. However, I think compared to other countries, our trends are still low. So the chances that we may have to close schools, it's not there, but it's something that we need to look at. This is a learning process. We're still learning the effect of the reopening. What we need to do is pay more attention towards our madrasas and see how they're going to fare when they start going. We have inspected a few madrasas. They have made a lot of efforts, but we're looking at the madrasas in the lower classes, where in the low income areas where they may not be able to meet the basic minimum, and this should be supported by the Muslim community generally. And where these basic minimum have not been met, our advice is that the schools, the madrasas, should not be opened.
Okay.
Thank you.
Thank you. Just to update the figures, the current figures stand at 97,954. Of course, 221 cases, that was today. Total number of deaths so far is 1,703. Total number of people recovered from this virus is 80,671. And this is out of the total 88,854,636 people who have gotten this virus, and total recovered globally stands at 63,802,386. Of course, these are the figures as of 8th of January 2021. We are asking Allah subhanahu wa ta'ala to alleviate this disease from us. Now, Sheikh Abdul Latif Abdul Karim, together the team of the National Muslim Response Committee, you have been conducting trainings to madaris, across the country with your team, as you stated earlier. How many madaris have you trained so far, and what's the criteria for a madrasa or the teachers or the staff to get this training? How do they get this training?
Okay, Bismillah ar-Rahman ar-Rahim. There are two types of trainings which we do. There's the training for schools which is with the integrated the structure in terms of schools. When we say Muslim schools, we mean the integrated schools. The normal school, which has been integrated with the madrasa. This is a type, for example, just as an example, Nairobi Muslim Academy, Muslim Academy, Park Road, and so on and so forth. And then we have the madrasas. And then the madrasas also we have categories. For example, a full-time madrasa, whether tahfidh or for ta'lim. And then we have the evening madrasa. And then the duksi, if you want to put it that way. The duksi will be generally for the lower classes, for example, the ECD or the nursery. And then you have the other madrasa which teaches purely Quran and Islamic sciences, whereby students come or pupils come after school, so either in the afternoon or late afternoon. At least in Nairobi, I don't have the figures in my hands right now, but what we have done is we have categorized Nairobi into zones. For example, Kibera in South C, South B, that area, Eastlands, Umoja, and those areas of Kayole, and so on and so forth, and then Isli, in such categories. The criteria is what we've targeted the madrasas. So either a representative or two from the madrasa can attend, whether a male or a female. Yeah. So
do you have the trainings frequently at a particular center, or how exactly does it work?
We went to their centralized
area.
Yeah.
So you picked a centralized spot within the area, and then you gather all of them there, and you train them.
Yeah.
So what's the criteria of someone registering? That's the question. How does someone get to that particular training?
Yeah, to be a madrasa teacher. As long as somebody is registered or so with, or is a teacher of a certain madrasa, we invite a madrasa. So the madrasa will send
representatives.
One of their teachers or the head teacher also.
Thank you. That's very important. Faisal Mbarak, I mean, from public health perspective, what do you think now? Speaking to the teachers and the parents and the stakeholders in madaris and integrated schools outside them, what do you think, or can you say, is the importance of such a training when you're offering?
Thank you. Such a training is very, very important in that it builds capacity of the madrasa teachers, so that they are able, they are actually confident, because you know this COVID-19 comes with a lot of fear and uncertainty. So when we train them, we inculcate first of all confidence, so that the madrasa teachers are able to handle in case they meet a case of COVID-19. Secondly, building this capacity, we are able to, make the teachers understand or even provide psychological first aid to children that are able to children that have been actually affected, because you'll find that these children, after staying home for so long, they have actually encountered quite a number of problems. Some children have parents who have been afflicted by the disease. Some even have lost some parents. So when they come back to school, you find, or the madrasa, you find that the children are actually very much affected psychologically. So we have built capacity to these madrasa teachers so that they are able to give them, you know, some kind of counseling and also some religious, you know, Islamic concepts in order so that they are able to alleviate this burden that they have. Then also we've built capacity in terms of giving them ideas of how to handle cases like if there is overcrowding, what they should do, whether you know, how to control the disease in very simple ways like hand washing, wearing of masks, the proper way of wearing the masks, how they should disinfect and clean the surfaces of the madrasa, because sometimes, you know, you are told clean and disinfect, but you are not actually told how to do it. You know, how do you dilute the chemicals? How do you do the proper cleaning? When you tell the children to wash their hands, how do they actually wash their hands properly so that the microorganisms are not left in their hands? So all this we've actually given to the teachers so that they are able to deal with them, with the children and also themselves.
Oh, thank you. Thanks so much. Professor Muhammad Karama, lastly, we saw the team of National Muslim Response on COVID came out when the mosques were being reopened. They sent volunteers or inspectors who went to different masajid to inspect. They gave proper guidelines, of course, through the IFCK, Interfaith Council of Kenya, on what exactly should be factored in when preparing for reopening. And a number of inspectors were sent in masajid across Nairobi and the country at large, which then gave a clean bill before the mosque could be opened. Are we likely to expect the same with Madaris as well, that you're going to send inspectors who are going to act on your behalf as an entity before they are allowed to operate?
Thank you for that question. I think we have trained people in Nairobi, in Mombasa, in the urban areas, and we have given guidelines that what is required for the madrasas. And we have used the Ministry of Education, the Ministry of Health guidelines. We've just domesticated it to fit into the madrasas. We are training the teachers so that they can go back. For example, what you have been told about trainings, we're training trainers. We may not have the capacity to visit all the madrasas and so on, but it is likely that we will be able to visit in some of the urban areas where we have trained people, where we have the multiplier effect. When we train trainers, they go and train others, then they can oversee, and then we can sample. We may not be able to go to all the places, but we will try to follow up to ensure that we visit some of these madrasas to ensure that they meet the basic minimum. But our hope is that those who are trained will form the group that will be overseeing for themselves. Okay.
Inshallah. Now, Professor, your parting shot tonight as we are wrapping up this conversation tonight on the state of the Muslim institutions and this COVID era. What would be your parting shot? Thank
you very much. I think I want to urge Muslims that they should not look down upon Islamic education. They need to ensure that the attention they give to secular education is equally given to madrasa. Madrasa teachers are looked down upon. They are not paid. The standards infrastructure in madrasas are very poor. And in this era of COVID-19, this madrasa and other lower level institutions could be a source of infection. We want to make sure that we avoid that aspect as much as possible, and therefore Muslims need to come up and ensure that the madrasas attain the basic minimum standards so that they can also be able to start and be able to to meet the requirements so that these madrasa institutions should not be a risk factors for transmission of COVID-19.
Jazakallah khair.
Thank
Now,
you.
Mr. Faisal Barak, what would be your parting shot tonight?
My parting shot is to the madrasa teachers, the ustad and the ustadas, is that they should try a little bit more to be more proactive, so that they are able to also get some IT skills, so that they are able to also do some online studies for to do online studies with the children, because you'll find that quite a majority, a big number of them, were not able to do online classes for the children during the school shutdown. So mine is just to urge them to do a little bit of try to learn about online studies and IT, so that they are able to also give some of this knowledge to our children.
Oh, thank you. Jazakallah khair. Thank you so much. Sheikh Abdul Latif Abdul Karim, please.
Bismillah ar-Rahman ar-Rahim. It is for it is the responsibility of the Muslim community to look after the madrasas. Alhamdulillah, the schools are being taken care by the government. So the financial resources in terms of the teachers are being paid by the TSC, and the other facilities are being catered by the government. But then in the madrasa, it is on the shoulders of the Muslim community. So it is upon the Muslim community to look after their own in terms of the madrasas and their teachers and the infrastructure and so on and so forth. So we have to come together, join hands for our own institutions. The ones who have no capacity, they should either learn online or look for other ways. But we have to balance. On one side, we don't want our children to miss classes, the madrasa classes, Quran recitation, so on and so forth. And the other, on the other side, we have the fear of infection. So we have to balance. If we don't have the capacity, let's wait a bit or look for other innovative ways, for example, use of technology and so on and so forth. Jazakumullah khair.
Jazakallah khair and barakallah fiqh. Thank you so much to our panelists tonight for making time for us this evening, and of course granting us from what Allah subhanahu wa ta'ala blessed them with. Thank you so much to all your panelists. Thank you, Professor Muhammad Karama. Thank you so much, Mr. Faisal Mubarak, and thank you so much, Sheikh Abdul Latif Abdul Karim. Thank you so much to the crew, and thank you, the viewers. Thank you so much for keeping us company. I hope you have benefited as much as I have benefited right here in studio, and we are going to take action immediately. Why? Because as Shuyukh said here, is that it is our responsibility to teach these children the religious education, and also our responsibility to take care of the madrasa teachers. So I hope you are going to take that action immediately. I've been your host Faisal, Kassim, and this has been the Live Real Talk. So see you next week, same time. About the place, we'll find out then. Assalamu alaikum wa rahmatullahi wa barakatuh.
You're watching Horizon TV, the beacon